Hello, it's great to see everybody here today. My name's Chris Cavalinas. I'm currently pursuing my DMP degree at McKendree University, and I work as a clinical nurse manager for Barnes-Jewish Hospital. Thank you for allowing me the time today to discuss a very important topic with you. I'm here to illustrate the need to support our nurses and encourage them to engage in self-care. The best way for us to help inspire this self-care is through discounted fitness memberships at our fitness center, Move by BJC. By the end of this presentation, you will be able to 1. Identify the biggest barriers to nurses performing self-care, 2. State the 4 ethical principles related to providing discounted fitness memberships, and 3. Describe 5 social determinants used to warrant this intervention. First, we're going to talk about how this intervention aligns with the BJH Mission, vision statements, and beyond. The mission and vision of BJH, simply stated, is to take exceptional care of people and be national leaders. This statement can be interpreted to not only reference patients, but the employees also. As a leader, this intervention is extremely important. The role of the leader is to encourage and care for the staff that care for the patients. By caring for the staff, the leader is also ensuring the patients are cared for. Ross, Bevins, Brooks, Gibbons, and Wallen, 2017, stated having the knowledge does not ensure nurses will perform self-care. These researchers also emphasized proper nutrition and physical activity are considered the first line of defense to combat obesity and to prevent cardiovascular disease. This, along with the American Heart Association recommending at least 150 minutes of moderate activity a week and a diet filled with grains, fruits, and vegetables. There was also a link found between the amount of sleep a nurse receives and obesity, as well as social support and participation in exercise. The American Nurses Association Enterprise 2019B stated, "The well-being of nurses is fundamental to the health of the nation." The ANA created Healthy Nurse, Healthy Nation Grand Challenge as a social program to improve the health of the nation by focusing on the nurses. Encouraging nurses to use this website would be a beneficial supplement to their fitness efforts. As leaders, supporting this intervention aligns with the American Organization of Nurse Executives' Nurse Executive Competencies of Public Health. There are 2 competencies that relate most to this intervention. The first competency was leadership and foundational thinking skills, where the leader develops and supports roles and processes to focus on issues in population health, and the second competency was professionalism and advocacy. Here the leader ensures quality of life and of the population served. There are several ethical principles as outlined in GRACE 2018 that are an underlying basis of providing discounted fitness memberships to our nurses. First is the principle of justice, where the benefit is distributed among the group. Many of our new nurses join the workforce with school loans they must pay, and some nurses also have families they must support. Providing a discount will allow more nurses to enjoy the benefits of a fitness membership. By providing this opportunity to more nurses, it also allows nurses the autonomy to choose to participate in this health beneficial activity by minimizing the barriers. By performing goodwill towards others, BJH will be supporting the principle of beneficence through the provision of this benefit to the nurses. And finally, by making this commitment to the health of the nurse over monetary gains, BJH will be supporting the principle of fidelity. As considered in Sorrell 2015, a crucial piece to consider while communicating this added benefit will be staying cognizant of the potential for staff to see this benefit as a means of challenging their autonomy and the principle of beneficence by creating a way for the organization to steer them to a particular health program. So next we'll look at the epidemiology at-risk analysis and the why. When reviewing County Health Rankings and Roadmaps 2019 for the St. Louis City population, it showed 24% of the St. Louis population has poor or fair health, as compared to 19% in Missouri overall and 12% in the United States. These results ranked St. Louis City at 112 out of 115. 35% of the adults in St. Louis City are obese. Comparatively, Missouri has 22% rate of obesity, and the United States has an obesity rate of 26%. Additionally, 25% of the St. Louis City population was physically inactive, which is the same as Missouri overall, but the U.S. reports physical inactivity at 19%. The Centers for Disease Control and Prevention had findings that corroborated and expanded on this information. The CDC discovered all of Missouri, not just St. Louis City, had an obesity rate of 35%. The CDC further broke it down by education, stating the more education, the less obesity, showing 35% of those who did not finish high school versus 24.7% of the people that graduated college were obese. Another piece of the equation was that as age increased, so did obesity. These overall findings did not correlate with the data discovered specifically for nurses. Based on information from the ANA 2016, 68% of nurses put the needs of their patients, health, safety, and wellness above their own, constituting the largest barrier between nurses and self-care. Due to this alarming statistic, this author has chosen to look at self-care with an emphasis on diet and exercise to combat obesity for the nurse population, specifically at Barnes-Jewish Hospital. In a deeper dive, the ANA collected data from 18,537 participants from December 2017 through May 2019 and identified 5 areas where nurses need to focus their self-care: physical activity, nutrition, rest, safety, and quality of life. The results showed only 25% of nurses participated in vigorous aerobic or strength training exercises 3 or more days a week. The average body mass index for the nurse is 28.5, which falls in the overweight category. 79% of nurses experience workplace stress, and 64% of nurses get 6 to 7 hours of sleep a night. These results have worsened since the survey initially conducted October 2013 to October 2016. An economic consideration for the nurse is that obesity is a common comorbidity and contributing factor for many health concerns, such as diabetes, hypertension, and cardiovascular disease. The excess weight of the nurse and the general population will ultimately contribute to the consumption of increased amounts of healthcare, and in turn, money spent on healthcare will increase. Some pertinent information obtained during the windshield survey is there are many different ethnicities and cultures, each with their own beliefs and traditions around weight, food, and exercise. There are no grocery stores easily accessible from Barnes-Jewish Hospital, leaving only the cafeteria and fast food delivery as meal options if the nurse does not pack a lunch. BJH is located on a busy urban street close to multiple interstates. The area may not be the safest for exercise, but Forest Park is located across the street from BJH for outdoor activity away from the threat of traffic. The footprint of Barnes-Jewish Hospital covers many city blocks, and all are connected without needing to go outside. This does offer a safe place to walk without being subjected to the many seasons seen in the Midwest, but it is not an appropriate location to truly elevate the heart rate for aerobic benefit. In looking at Healthy People 2020, this author chose the goal of nutrition and weight status with a focus on Objectives 8, increase the proportion of adults who are at a healthy weight, and Objective 9, reduce the proportion of adults who are obese. In light of the focused analysis which was conducted, there were several social determinants of health identified to influence the decision to select this intervention. The first social determinant was social stigma and discrimination. These are encountered by the obese population. The second was health literacy, with the fact many nurses are not able to identify health implications of obesity. The third was environmental conditions, being those where the hospital is located in a high-traffic urban setting. The fourth is social cohesion, by trying to build a community where nurses will call on each other for support. And the final social determinant is access to healthy foods and eating patterns. So next we'll talk about population health intervention. The what, who, where, how, and when. So the what. The first step to offset these social determinants, increase the number of nurses that exercise, and combat the high obesity rate found in nurses is to offer discounted fitness memberships to the nurses employed by Barnes-Jewish Hospital. Egertson 2013 found a lack of support in the workplace was an obstacle to making a lifestyle change. Additionally, they illustrated that having fitness programs at work offered during lunch hour is a way to balance exercise with work and personal commitments. Move by BJC offers personal trainers to train and support the nurses. This personalized fitness, along with year-round access, was important to the nurse and their success. Not only is this intervention good for the nurse, it's good for the patients and organization. Nurses who participate in health-promoting self-care had greater job satisfaction, a higher degree of productivity, and provided superior quality of care. Additionally, these health-promoting self-care activities increase the likelihood the nurse would discuss and recommend health-promoting self-care to the patient. Feasibility and sustainability. Move by BJC is already open and staffed. Therefore, there are no startup costs and the facility is already feasible and sustainable. The profitability could be impacted by the addition of members at a lower cost, but this cost could be offset by the potential addition of family members and word-of-mouth advertising about the facility and the benefits of healthy lifestyle choices. An influx of even a small portion of the 3,738 nurses employed at Barnes-Jewish Hospital would require additional trainers. Each trainer would require an annual salary of $60,000 and could see a maximum of 25 clients per week. The goals of this program would be to offer access to a fitness facility at a discounted rate. This access would be utilized to decrease the obesity rate in nurses. The metric used to evaluate success would be lowering the average BMI of nurses from 28.5 to the healthy range of 18.5 to 24.9. Additionally, the goal would be to motivate 25% or 935 nurses to join Move by BJC within the upcoming year. For the timeline, being that the fitness center is already open, the implementation of this intervention would not be affected by startup costs or space procurement, hiring, or training. The need for hiring new trainers could be evaluated as new nurses join the fitness facility and request individualized training from the personal trainers. The best time to launch this new program would be the start of the new year to capitalize on the New Year's resolutions that typically revolve around fitness and losing weight. The beginning of December could be utilized to create a marketing plan with the launch of the marketing in the last week of the year, which would be December 26th. A few low-cost, no-cost options would be to place the information in the rotating screensavers on all computers within BJH, flyers around the hospital, and email blasts describing the benefits. So the who. The stakeholders for this initiative would be the chief nursing officer because this intervention has a direct impact on the nurses under her purview, and the director of finance department to mitigate the decrease in the profit margin from Move by BJC. Additionally, the director of benefits would need to be involved to help communicate this added benefit, and the director of compensation would be involved to figure out the tax implications for the added benefit. The nurses themselves would be stakeholders, and finally, the patients under the nurse's care would be indirect stakeholders because of the advice and education the nurse would give to patients about the effects of fitness on health. A key player identified would be the manager overseeing the operations of Move by BJC. The where. The fitness facility will be housed at their new location within the BJH Extended Campus at 4220 Duncan Avenue, number 103, St. Louis, Missouri 63110. Again, this fitness facility is already in operation. The how. Success will be determined by enrollment and decrease in BMI as outlined in the goals. Data will be collected through enrollment questionnaires and periodic weigh-ins. Data will be analyzed monthly to track progress towards the goal. Funding is related to the loss in potential revenue as the decrease in membership fees lower the gross margin, and salaries incurred for the hiring of additional personal trainers would be covered by the fees paid for these additional services. Finally, the when. Again, this would be rolled out on December 26th to capitalize on the push for better health come the new year. This will be an additional benefit offered to the staff and will be implemented at a fitness facility already in operation by the system. These facts create an ease for sustainability. In conclusion, we've covered a lot of information in today's presentation. Let me utilize the logic model to summarize our discussion before we leave today. In defining the problem, 68% of nurses put the needs of others above their own. This translates to only 25% of nurses getting vigorous aerobic exercise or strength training 3 or more days a week. Obesity is a growing national concern, but the average BMI of nurses specifically is 28.5%, making the average nurse overweight. The intervention is to expand the benefits package to include discounted fitness membership fees at Move by BJC to nurses employed at BJC. The goal of this program is to increase access to a fitness facility. The key objectives are to encourage 25% of nurses at BJH to enroll at Move by BJC and decrease the obesity rate in nurses from a BMI of 28.5% to a healthy range between 18.5 and 24.9. The desired outcomes by implementing this benefit will create a healthier nursing workforce, increase job satisfaction, and improve productivity. These outcomes will be a catalyst for nurses to recommend and discuss healthy lifestyle choices for the patient. All these outcomes will inspire the delivery of superior quality of care and help BJH realize our mission and vision. I want to thank you for allowing me here to talk with you today. Are there any questions about the information that we've discussed? So I see no hands, but I do want to say that I'm extremely passionate about caring for our nurses, so please reach out to me with any questions or concerns you may think of after the close of our meeting. I can be reached at christopher.cavalinas@bjc.org or my work phone 314-571-0815. Thank you again for your time today to present this option to help support the health and well-being of the nurses that take care of our patients and allow us to live up to the mission of taking exceptional care of people. So the next few slides list all of the references used for this presentation.